Imagine having to wait 2 years before you can get a surgical procedure done. That's the predicament some Jamaicans are currently grappling with, as one of the knock-on effects of the COVID-19 pandemic has been a major backlog in surgical units across the island's public healthcare system. Health and Wellness Minister Dr. Christopher Tufton described the lengthy wait times currently being endured as inhumane, admitting that more resources desperately need to be pumped into the healthcare sector. There was already a backlog of about 7,000 surgeries as of 4 months ago, according to reporting from the Jamaica Observer. It is cruel, Tufton remarked, noting that this was definitely a situation authorities deemed suboptimal and committing to reprioritizing national resources over time to address the situation. In the interim, 4 private hospitals have stepped up to help ease the overburdened public healthcare system. Bay West Hospital, G West Surgery Center, Montego Bay Hospital, and the Urology Center Hospital will together attempt to process nearly 600 outstanding surgeries within the Western Regional Health Authority catchment area as part of a $70 million Jamaican dollar initiative dubbed Code Care. In its entirety, the 3-tiered Code Care project is expected to cost up to 10 times that amount, 700 million Jamaican dollars, just over 4.6 million US. The money, Minister Tufton said, was a worthwhile investment in bringing down the burdensome backlog. He says the ministry was able to avoid paying full market price for some of the procedures, which would save about $40 million in local currency overall. Tufton expressed gratitude towards the private operators for agreeing on discounted rates for their services. Patients who have been waiting the longest will be prioritized when it comes to scheduling their surgeries. The Western Regional Health Authority's clinical coordinator, Dr. Delroy Faray, says the backlog wasn't just affecting the patient's health and the anxiety levels of their loved ones, but was placing a drag on the economy as a whole, as some patients, such as those awaiting surgeries to fix hernias or patients with scheduled hysterectomies, were unable to work until their procedures were completed. While the Ministry of Health deals with the urgent matter of reducing the surgical backlog, Tufton says it will also conduct an assessment of the entire healthcare system to identify areas needing intervention and improvement. The minister noted the need to improve operating theaters and also highlighted how the current exodus of nurses from the country was leaving Jamaica with a shortage of highly trained and highly skilled operating theater nurses in particular. Due to this shortage, the minister announced that his government would be soon hiring traveling operating theater nurses to assist in public centers until the local human resource issues can be stabilized. Tufton described the arrangement as initially having the nurses rotate in for a 4 to 5 day week before returning to their substantive positions. The minister responded to the question of outsourcing the country's labor needs in the healthcare industry by saying it was necessary to meet the needs of the population.